Hi everyone, I'm Sammy, for those who don't know me, and for those who do, sorry, but I'm gonna introduce myself. Anyways, I am making this video because I get a ton of messages in my DMs about my gastric sleeve surgery experience and about hair loss and about loose skin and all that fun stuff. So I kind of wanted to share my story because I feel like it's important to get out there and just know that every person's story is different. So don't try to take this too seriously. But so I had my surgery on September 17th of 2018, and I kind of had complications right from the get-go. I couldn't eat or drink pretty much anything after surgery. It was really, really hard on my stomach. It hurt so bad to drink water, to drink a protein shake, anything. So for a couple weeks, I was really struggling. Nothing really went down well. Like I said, it just hurt. So November 5th, I had my first kidney stone, which only lasted 45 minutes, which is, I guess, super rare, but yeah, it passed very soon, and I was like, oh, wow, oh, that sucked, but whatever, move on. 2 days later, I developed my second kidney stone, which was god-awful pain, okay? Like the worst pain I've ever experienced, and your girl has had a child and 22 hours of labor and a C-section, so okay, it really hurt. And that lasted throughout the entire night. I finally woke up my mom and I said, I need to go to the hospital. This is absolutely ridiculous. At this point, I was throwing up because of the pain. It was so intense, and I guess that's like a thing. I didn't even know that you throw up because you're in pain. And first of all, I didn't even know that I could throw up because 85% of my stomach was gone. But anyways, went to the hospital. They gave me a bag of IV fluids, some painkillers, and sent me home. Went home. I specifically remember I was still throwing up. I was in so much pain. It was like in my right lower back. Oh, it was awful. And that kidney stone lasted for 9 days. So that's an important number to remember, is 9 days of kidney stone pain and throwing up. So yeah, like I said, 9 days, I'm still throwing up. I go back to the hospital. I tell them I don't think it passed, yada, yada. And basically they gave me one more bag of fluids, said, sorry, I don't see it on your CAT scan. So at this point, the pain was going away after, the 9 days, but I was still throwing up. And when I say I was still throwing up, I'm talking 15, 20, 30 times a day, depending on the day. So the days kept going by, and at this point, I'm missing work. I am lacking of taking my child to school because I'm so sick. It was just going downhill really fast. So I went back to the hospital again, told them I'm still throwing up. They did a few more, CAT scans, ultrasounds, didn't find anything. Sent me home. So after that, I was kind of starting to give up because I was like, I don't understand why I'm still throwing up. This really sucks. I'm getting weaker and weaker every day. At this point, I'm drinking maybe a sip of water every single day, and that's it. And kidney stone pain is gone, but why am I still vomiting all the time? Then I started feeling my lower body tingle, like hardcore. I specifically remember taking a shower and shaving my legs because I knew I had to go to the doctor's office, and I couldn't feel the razor on my leg as I was shaving. So I went to the doctor and I said, I can't feel my legs. And he ordered me a blood test and called me and said, your pancreas levels are extremely low. I want you to go back to the hospital. Went to the hospital. They checked out my pancreas. Everything was fine. I just had an inflamed pancreas, but that was from throwing up. So fast forward a couple weeks more, I'm still throwing up 20, 30, 40, 50 times at this point. I mean, it was nonstop. I basically just laid in the recliner and just would get up every couple minutes just to go to the bathroom, which is awful, was awful thinking about it. Just, ugh. So, like I said, I was still vomiting. After many hospital visits, no one could figure out what was wrong. And at this point, I'm walking like a baby deer or a 95-year-old grandma, and could not walk without assistance from my mom's arm, my stepdad's arm. Whoever was around me had to help me walk, which as a 29-year-old girl is, no, at this point I was 28, whatever, is terrifying. So I finally go to the hospital one last time, and we had to use the word medical advocate in order for me to actually be taken seriously, which I hate to say that, but yeah, that's what happened. They did an upper GI, they did some more ultrasounds, they did a CAT scan, they finally admitted me and ran tests for 5 days, found absolutely nothing. They wanted to find an ulcer, something to explain the throwing up, but no such luck whatsoever. On the last night of my hospital stay, I was laying in bed watching Netflix, and I started to feel that numbness that I've been feeling in my lower body go up to my chin and my arms. And I thought, holy crap, it's gonna take over my face. It's gonna take over my entire body, and God knows what's gonna happen from here. So I beeped the nurse, and she comes in and she said, okay, we'll talk to the doctors tomorrow. I'll make notes. So the doctors come in, 3 of them standing around my bed, and I tell them what's going on. And they said, oh, that's weird. Yeah, you could be low on potassium, but we'll check. They ran a potassium blood test. I was 0.1 under the normal average range, and they decided to just blame it on that. So they gave me banana pills, a potassium drip, which hurts like a son of a bee, and yeah, that's kind of what they were saying. So let me also go back about a week prior to this hospital visit. I spoke with my surgeon who did my surgery, who was retiring that day. He actually stepped out of his retirement party to come speak to me on the phone. And I told him what was going on, and he said, yeah, that's normal. And I told you before, you're only 28 years old, you shouldn't be having the surgery, but I warned you, but it's normal. And I just remember feeling so defeated. I remember thinking, okay, if this is normal, I'm going to die, because there's no way I can live like this. There's just no way. I actually wrote up a will in my phone, and like I said, I have a 10-year-old daughter. I really took that to heart, that this was my new normal, and if this was my new normal, there's no way I was going to survive it. I'm sorry, but you can't not eat or drink anything for forever and throw up 40 times a day and expect to survive. So yeah, that was, like I said, about a week before that hospital visit, and I was in the hospital just thinking, I can't do this. I can't live like this. Someone needs to figure out what is wrong with me. So back to the hospital visit. I am now, like I said, on my 5th day there. They decided to discharge me because they couldn't find anything wrong. And so I have Kaiser insurance, and I guess Kaiser doesn't really communicate from branch to branch. So I had my surgery up in LA, and I'm in Orange County, and I was getting all of my hospital treatments, doctors, all of that in Orange County. And I spoke to the PA who was working hand in hand with my surgeon, And I said, yeah, well, last night I experienced that the numbness was going up to my chin. And he goes, I'm sorry, what, the numbness? And I said, yeah, like I'm numb from my waist down. Like, is that not in my charts? Couldn't find it in my charts. He had no idea. So he said, do not let them discharge you. I'm going to make a note in the system to give you one last blood test, and I need to check something. So they did the one last blood test. He called me back about 2 hours later. He said, I'm making an appointment for you to come in tomorrow, 9 a.m. You need to meet me here. So we drove up, my mom and I, and met up with the doctor. And he comes in the office and he said, so how's your eyesight? And I'm like, I mean, I have astigmatism in my left eye, but fine, I guess. And he goes, okay, and your memory? And I'm like, fine. I mean, I'm a little foggy, but that's because I haven't eaten or drinking anything, and yeah, sorry. And he's like, all right, so do you want to know what you have? And I'm like, okay, yeah, I have something. That's fantastic. And word for word, he says, it's a cute little name called beriberi. And I'm like, okay, WTF is that? And basically it is a vitamin deficiency. And the vitamin that it is B1, which is your thiamine deficient, or your thiamine vitamin. Clearly I'm really good at this medical stuff. And so yeah, I developed beriberi, which is, like I said, a thiamine deficiency. And I guess if you do not eat or drink anything within 7 days, you lose your B1 vitamin, which causes you to throw up. So remember how I said kidney stone lasted for 9 days, you lose your B1 in 7. So, which is why it just kept continuing over and over and over, the throwing up and all of that. So if you Google beriberi, it's Beriberi, and it is a rare medical condition. It doesn't really happen here unless you're homeless and you cannot find food or water in 7 days. And also over in countries that do not have access to food and water is where it's most common. So from then on, I learned that it can cause permanent memory loss, blindness, heart damage and heart failure, and permanent neuropathy. So at this point, I'm thinking I'm gonna be numb for the rest of my life, but at least I have my memory and my heart is okay and I'm not blind. So yeah, fast forward, I had to have multiple tests on my heart, my vision, went to many doctor visits where they would poke and prick me and test my my reactions on my legs and all of that good stuff. So I would explain to them how my numbness felt was that in terms of how many leggings I was wearing, which is kind of silly when you think about it, but at first I felt like I was wearing about 50 pairs of leggings, if that will give you some sort of reference. And then I would tell them, okay, today I'm wearing 35 pairs of leggings, and so on and so forth. And it finally got down to now, a year and 2 months later, I feel like I have about 2 pairs of leggings on. So I guess your nerves heal from the belly button down. Don't quote me on that, but so yeah, I can feel most of my lower body. My chin's fine, my arms are fine, but for the most part, yeah, I can feel, but I do still have some residual neuropathy, which sucks, but it is what it is. So yeah, that was my major complication. I am okay now. My vitamin levels are totally fine. I am active. I feel healthy. Yeah, so don't let that scare you. Another thing that I want to touch on is, well, I don't really want to touch on it, but I feel like I should, and I get this question so much, is hair loss. I can't speak for your experience, I can only speak on mine, and like I said, as much as I don't want to, I feel like I should. And I had such a traumatic experience. Like I said, I had that vitamin deficiency. I was so sick, so sick, that I experienced more hair loss than the average gastric sleeve patient, I feel, would. This is not my real hair. Much as I don't want to tell you all that, it is actually a wig. It is from the hair shop in LA, which, fabulous place. It's where Kim Kardashian gets her wigs. Her name is Reese. Okay. Dang, this is so awkward. And it's only awkward because as women, our hair is our statement piece, I feel. One of the first things we say to someone is, oh my gosh, your hair looks so good. You're having a good hair day. All about our hair. And it's not a good time. Now, my hair is coming back like way back and then some. I have about this much regrowth. But I mean, I can't wear it out. I can't wear my hair down. It's not cute. I don't want a pixie cut. I just feel like that wouldn't work with me. So when people ask me, did you experience hair loss? I'm so worried about thinning hair, and what did you do? And your hair looks great. And I have to be honest with you guys. I mean, I do message most of you back telling you what's up. I tell you the truth that this is not my real hair. And I don't want to tell people that because I don't want to scare them away from the fact that they're going to have like the same experience as I am, because it's totally not true. I mean, I do have some of the same experiences, some gastric sleeve patients, of course, but don't let it scare you. Don't let my situation scare you. And you can always go get yourself a cute wig and rock it, and you don't have to tell anyone, or you can tell the whole world like I am. But like I said, just don't let my experience scare you. And the third thing that I will touch on that I don't want to, but I will, is loose skin. And I get that question quite often, probably a couple times a day, honestly, is, did you have any skin removal surgeries? Your skin looks great, blah, blah, blah. People, it's called Spanx. It's called sucking it all in. It's called wearing the right clothes for your body type. Of course I have loose skin. I was 363 pounds. I am now 157, bound to have loose skin, and I lost all of that weight within 15 months. So yeah, I do. It sucks. I don't want to be 29 years old and have all of this. I don't want to have to wear a wig. I don't want to have to have loose skin. I don't want to have skin removal surgery. But you know what? I can tell you right now that my life has never been better than it is right now, ever. I am happier than I ever have been. I feel like I am in a good place. I feel like this is where I'm supposed to be. I feel like I'm supposed to be sharing this with you, with people. Having this surgery has changed my life 100%. And that's why when people message me and they ask me about if I've had complications and if I regret the surgery and all of this, and I felt like this video was important to tell everyone, because I don't want to sit there and lie and make it sound like I had the greatest experience and I lost, 205, however many pounds I've lost, in such a short amount of time and yada yada. I feel like it's important for me to tell everyone, only because I don't want to fake my experience. I don't want to make it sound better than it was, but I also don't want to scare people out of it. So yeah, that's pretty much it. If you have further questions, you can always DM me. If you are thinking about the surgery, I really encourage you to do your research, and don't let other stories scare you. Like I said, every experience is different. And if you've had the surgery recently, I'm going to encourage you to drink your water, take your vitamins, eat your protein, because and if you are not even in the weight loss surgery community, or you're just watching this for fun, I appreciate it. Thanks for letting me be so vulnerable. But I figured that if I share my story and if I put myself out there and really let everyone know what happened, and believe me, I don't really want to put this out there. I don't want to upload this video. But if I can help one person by putting myself out there and sacrificing myself, that sounds really bad. It's not what I meant. Sacrificing my emotions, my feelings. If I can just help one person out of this, then I feel like I've accomplished something. So, like I said, if you have any questions, just message me, reach out to me. But yeah, I hope everyone enjoyed this, and I don't know, maybe I'll make another one of these if something comes out of it. But yeah, thanks everyone. Bye.